For each infusion, it is different. It depends on the drug regimen that you were receiving. From there, the treatments can last anywhere from half an hour to, we have some treatments that go like 8 to 10 hours. So it really just depends on the infusion length for the drugs themselves.
If you're getting your blood drawn that day, you'll check in and wait to be called for your blood draw, and your labs have to come back.
You are able to get your labs drawn up to 48 hours prior to your treatment. That is something that we like to encourage people to do because then we already have your labs back, and so that can end up saving you a lot of time.
Certainly I would recommend having a driver your first few times. You don't know how you're going to feel, especially you're going to be nervous going in and you might feel a little rough coming out.
Until you know how your body's going to react to the infusions that you're getting, we recommend having a driver. And if in future treatments you don't want to have a driver because you've done well, I still recommend people having somebody kind of on call, that if they did need a driver, if they were feeling differently from past treatments, that they could call somebody and say like, hey, I think I need a ride today.
Just being as healthy as possible when you are going through infusion or chemotherapy, because it can't do anything but help. I was always hydrated with just some kind of carbonated drink.
Especially if a patient is getting a peripheral IV, so that's when we put an IV in your arm. It's really helpful to have hydration the day before, meaning drinking at least 64 ounces of water the day before would be helpful, and even more if you can tolerate it and if it's not contraindicated by your doctor.
For infusion clothing, I recommend loose-fitting, like I have on now, loose-fitting clothing, especially so they can get access to the port or the veins and easily work with you during the infusion process.
In general, after we have your IV access established, it's useful to have layers. The temperature can vary in infusion a bit, and we do have warm blankets to add if you get cold, but it's a little bit harder to start taking things off if you get warm, so just layering is important.
If you want something to bring, I suggest things that you can bring in an individual packet, like a granola bar, some chips, trail mix, things like that you can just bring and open up and eat there.
We do have menus available that you can order, but it takes at least an hour for the food to arrive. So sometimes some treatments aren't even long enough for that to happen. If you have something special that you need, it would be good to bring something.
I had my own blanket. I had little snacks, things that I really liked. In infusion, they would have snacks for me, but if I wanted certain snacks, I had to make sure I had everything packed in my bag, along with maybe even a journal if I felt like writing. Generally speaking, I didn't feel like doing anything, but I had all those things available.
In terms of entertainment, most of our areas do have televisions available, but it's not a guarantee that you're going to have a television, and also you might have to share it with another patient depending on where you are. I've seen people bring tablets and watch movies. I've seen people on their cell phone. I've seen people with books. We've even had some patients there for longer days who bring a board game, and they'll play board games with their guests.
Definitely, if you have some headphones, bring your phone, bring a media player, listen to music. As long as it's quiet, you can bring anything. Lots of reading, lots of crossword puzzles in the infusion center.
If you are getting an infusion that requires a pump that we send you home with, it's very important to make sure that you bring the pump back with you. Otherwise, it can cause up to hours of delay.
Because chemo brain is real. There were times when my husband asked the questions that I needed to ask because I could not remember them. Just write down anything that comes to mind.
Well, definitely if you need to take medication at a certain time, because you will be there most of the day, bring your medications.
We allow patients to take any of their home medications that are prescribed by their doctor. So if there's anything that you're going to be due for while you're in infusion, it's good to bring those from home. And then all we ask is that you let your nurse know that you have taken them.